Doctor, no one's spoken to us for a few days now. I mean, we agreed to those clot busting drugs and he doesn't seem to have improved. We were told he would. Why hasn't he? I mean, he was always very fit and active and I mean, should my daughter come home from America?
I appreciate that this is a really difficult time for you, for all of you. When a stroke happens, it happens very suddenly and it's difficult to predict how it's going to go.
But we don't seem to know what the matter is and we don't know what's happening.
Can I ask, what have you been told so far?
We were told that you were giving him that clot busting treatment and that was supposed to make him better, but it just made him worse. And that you've done another scan, but we don't know what the results are, and we just don't know what's happening.
Let me just check what's happened. Okay. I can see that when he was admitted, he had had quite a severe stroke, and the team felt that the clot busting treatment was the best thing at that time. Now, some patients don't improve with this treatment, and it seems that Mr. Smith hasn't improved.
But the doctor said he would improve. Why hasn't he?
I'm so sorry. Some patients don't improve with treatment. It's always uncertain in the first few days. We don't know who will benefit and who will not. This must be really hard for you.
The doctor said he'd improve.
Look, here's the brain scan after the treatment. You can see this large darkened area of the brain, which is the stroke.
So does that mean he'll stay like this? He won't get better? Will his brain recover?
It's hard to say how much recovery there might be. As time goes on, this is less likely to happen. Your husband has had a large stroke, and we're doing the best that we can to help him. He has the best chance of recovery being cared for by the doctors and nurses in this ward. And being here will give him the best chance of recovery.
But does that mean he might stay like this? He might not get better? I mean, he'd hate to be like this. Is he going to die?
These are difficult questions. Early after a stroke, it can be hard to say who will recover or not. He has had a severe stroke. You see, a large area of the brain has been affected, and it's likely that he'll be significantly disabled if he survives.
Doesn't sound good.
Unfortunately, he was more unwell this morning, and we believe he may have a chest infection. His temperature is up and he sounds chesty.
It really doesn't sound good.
We would generally like to treat a chest infection in the early stage of stroke.
He'd hate to be like this.
Can I ask, did he ever discuss with you how he would like to be treated if he had a severe stroke?
No, we never had those sort of discussions.
Well, if we don't treat him for the chest infection, he may die.
But we'd no idea he was so ill.
I can see how difficult this is for you all, especially as he was so fit and active before.
Yeah, he was always on the golf course, wasn't he? Do you think my sister should come back from America?
That's a difficult decision. But if he doesn't get better, if he doesn't survive this, she may regret not coming back.
This is awful.
Well, I think we need to decide whether to give him antibiotics. Normally, after a stroke, we would give antibiotics early after. What do you think he would want?
ever discuss this sort of thing. I mean, we're due to go on holiday next month. This is all so unexpected. I don't know.
It must be tough for all of you. I think I would recommend that we put him on a 5-day course of antibiotics and see how he responds to the treatment.
Okay, whatever you say, doctor.
Yeah, whatever you recommend.
We'll also make sure he gets oxygen, fluids through a drip, and physiotherapy to help clear the chest. We'll be monitoring his temperature and oxygen levels regularly, just to make sure that everything's stable.
Okay.
At some point we may need to think about a feeding tube, but let's just take one step at a time at the moment. Is there anything else you would like to ask?
No.
No.
Thank you for explaining everything.
So just to summarise, he's had a very bad stroke. We feel that it would be good to give him antibiotics for his chest infection. How do you feel about that?
It's just so awful.
I know this must be so hard for you. He was so fit and active. Can I suggest that we meet again tomorrow? I'll be on the ward and I can arrange for the consultant to come as well.
Okay.
Please don't hesitate to ask if you have any queries. I'd be happy to talk to the rest of your family if they'd like to come and meet with me. Is there anything else that you'd like to ask?
No, thanks.
No, thank you for explaining everything to us.